A lot of us will have heard of the Spanish flu of 1918. This was one of the deadliest pandemics in history that infected around 1/3 of the world's population and killed up to about 50 million. It impacted so many different factors like global health, society, the economy, politics. In this video, we're going to explore why this particular pandemic was so deadly and what it has taught us about managing future pandemics, like the more recent COVID-19. If you enjoy exploring how medicine has evolved through time and want to see similar videos, then please subscribe to my channel, Doctor of the Ages. Let's start by talking a bit about the Spanish flu. It was caused by a specific type of influenza virus called H1N1 influenza A. This particular strain was highly contagious through inhalation of aerosols and droplets. One of the most distinctive features about the Spanish flu was the phenomenon known as cytokine storm, and this is probably why it killed so many people. The cytokine storm exaggerated the normal immune response, so healthy young people with good immune systems would actually produce too many inflammatory signals, and this led to more rapid inflammation and lung tissue damage. Almost half of the virus-related death during the pandemic was surprisingly in young adults between 20 and 40 years of age, and it was probably because of this phenomena. Other complications of the virus included viral pneumonia, secondary bacterial infections, respiratory, and even multi-organ failure. So what was done at the time to try and minimise the impact of the virus? Public health measures were initially introduced, such as quarantine, isolation, social distancing, mask wearing, and closure of schools and other public venues. Health authorities also distributed information on the flu and how to prevent spread, so this included things like promoting regular hand washing and using handkerchiefs to cover coughs or sneezes. There were no antiviral treatments or vaccines available at this time, so their care was mainly just supportive. This meant that patients were encouraged to rest, drink fluids, and take medicine to reduce any fever or other symptoms. In severe cases, oxygen therapy was needed, and in other cases, old treatments like bloodletting were used, but this would actually often cause more harm than good, as losing blood could lead to anemia and further weaken patients' immunity. Most hospitals were overwhelmed by the high number of cases, and this led to temporary medical facilities being established in schools, stadiums, and military camps. But there were usually very limited medical resources on these sites, making the care suboptimal and leading to higher mortality rates. While the Spanish flu spread globally, there was limited international coordination in managing the pandemic. A lot of countries responded differently, and communication between regions wasn't very effective. In some countries, governments controlled the flow of information and downplayed the severity of the outbreak to avoid panic, but this actually led to widespread misinformation. The pandemic also led to labour shortages, widespread illness, and economic hardship. Once the pandemic was over, there was a significant societal impact, and this led to changes in public health policies and increased funding for research into infectious diseases. Now let's look at how this differed to our management of the more recent COVID-19 pandemic. Naturally, medical and technological advancements made a significant difference in the handling of COVID-19, but actually certain strategies from the Spanish flu era were relevant and did somewhat shape our modern management today. As we mentioned earlier, many countries did initially downplay the severity of the Spanish flu, leading to delayed responses, which in turn contributed to widespread infection and death. During COVID-19, governments and health organisations like WHO and CDC worked to provide frequent and transparent updates. They also understood the value of acting quickly. This meant there were early lockdowns, travel restrictions, and widespread testing were implemented in many countries to try and spread the limit of the virus. Social distancing, masks, and the closure of non-essential businesses and schools were key strategies to limit transmission of COVID-19. These measures were more rigorously enforced than in the past, with clearer information that we could distribute based on a scientific understanding of viruses. Early on in the pandemic, healthcare systems were stretched to their limits, similar to in 1918, but modern healthcare facilities, technologies like telemedicine, and the rapid development of treatments such as ventilators and home oxygen helped manage the situation. The lack of understanding of viruses for vaccine development in 1918 meant that the disease had to burn itself out over time. One of the major lessons learned was the importance of vaccine research and development. The quick development of COVID-19 vaccines marked a remarkable achievement in modern medicine, meaning we could manage the pandemic a lot more effectively. At least 50% of deaths due to COVID-19 were reduced after introduction of the vaccine. While the global spread of the Spanish flu was rapid, the ability to communicate and share data between countries was limited, so coordination and response efforts were quite challenging. In the modern day, with the use of the internet, global collaboration was much more streamlined. Scientists, governments and organisations shared data rapidly, and platforms like WHO and CDC coordinated responses across nations, and the global scientific community collaborated to develop vaccines and treatment protocols as well. There was limited ability to track the pandemic's spread and provide real-time data to guide decisions back in 1918, but with the development of technology, data analytics allowed for more accurate modelling of the virus transmission, helping inform public health decisions. Contact tracing, testing and vaccination programs were enabled by technology, and digital platforms allowed for remote working and education. The psychological and social impacts of the pandemic in 1918 were profound, but not fully addressed. Many communities faced isolation, grief, and trauma with little support. Nowadays, the importance of mental health support is much more openly recognised, and during the COVID pandemic, governments and organisations set up hotlines, online counselling, and other services to support people struggling with isolation, stress, and anxiety caused by the pandemic. In summary, while the Spanish flu taught the world valuable lessons, many of the strategies employed in managing COVID-19 were made possible by advancements in medicine, technology, communication, and international collaboration. This made the response to COVID-19 much more coordinated and informed. I hope you enjoyed this video and found it informative. If you did, please do like, share, and subscribe to my channel, Doctor of the Ages. Thank you.